Mari McInerney from Croaky here at the International Medical Regulation Conference, and I'm here with one of the the keynote speakers, Margaret Mungherera, who is the former chair of former president of the World Medical Council Association. Sorry, I'm going to get you to introduce yourself. Tell me where you're from and your roles.
Okay, I come from Uganda, which is in East Africa, and I happen to be the vice chair of the medical regulatory body for doctors and dentists, and I chair the ethics and discipline committee. I also happen to have been, I'm a past president of the World Medical Association for 2013-2014, and I was the second African since 1947 to be president of that association.
The first African woman.
And the first African woman to be. I'm here at the conference as an invited speaker to speak on Africa's challenges.
So you had 10 minutes to speak about that.
And I had 10 minutes to speak about.
I'm going to see if you can talk about it now in 5, because you need a cup of coffee.
Okay, in 5.
What were the issues that you wanted to raise? What is the landscape there?
Well, I want to just say that there are issues which are outside the health sector. So outside the health sector, which are really social, political issues that are there, that do impinge on the work that we do. And that is why it's very important for us to be aware of those and to be, having dialogue with the state, the public, with looking at those issues as well.
Some of those are around, especially around conflict.
Yes, exactly. And when you have conflict, you have refugees, and some of those are doctors. When you have conflict, our borders are quite porous because these divisions, these countries, these borders were artificially, they were done by people from outside. The colonialists did them, and therefore they're porous. People cross, so there's a lot of cross-border, mobility, and as that's one thing, the refugees, and the insecurities and displacement of people. But there's also the whole issue of mobility that's come about because of the political integration that we have now to try and solve some of our problems. So you have the East Africans and South Africans working together, some of them under SADC, under the East African community. We have the West Africans also working together. So they have those political organizations that they are, which are making sure that there's mobility, increased, there's ease of mobility of health professionals in the region because of the shortage. So it is a challenge for medical regulators.
You said that workforce issue is the big one too. You said there are particularly around mobility, which is not just within Africa. So what are those issues?
Because with brain drain, with migration outside the continent, you lose the highly qualified health professionals who are really the ones who, the academia. We've lost a lot of the academia who are really supposed to be the ones who are, in charge of, policies and, medical schools, the training and mentoring of young professionals. And so the brain drain has definitely affected the quality of medical education that we see in the schools.
You said there are other issues then for regulators.
There are other issues for regulators.
Stakeholders, you said.
The stakeholders. Can I just say that as countries look, as the economic, development of countries, improves. The economies of countries improve. We're all looking at the expansion of the private sector, and as a result, there's so many private schools that have come up, and therefore they're making even a bigger challenge for regulation. But we also have the perceptions of the health professionals themselves towards the regulatory bodies, which they see as policing them and looking for headhunting and looking for the wrongs that they do, and therefore do not their attitude too makes it difficult to really identify who to regulate. But also self-regulation becomes an issue, and I think a lot of it is because of the quality of training that they have on ethics and human rights in medical schools, which again is a curriculum issue. The medical regulatory bodies have tried to come up with harmonized curriculum. For example, the Association of Medical Councils of Africa is looking at a single harmonized curriculum. and many regional, this collaboration. But the challenge is having the medical schools adhere to the standards that are set by the medical schools in terms of the curriculum.
And do those curriculum and ethical issues, do they involve, one of the questions that came up was around cultural issues, for example, that in many parts of Africa it's illegal to be gay.
Yeah.
Is that the sort of issues you mean in those? Or
No, well, the thing is that whatever the issue is, whether you're talking about gay people or talking about people in the prison population who also have their own challenges. The most important thing is making sure that the health professionals know what their obligations are. So that regardless of whether they're dealing with prisoners of war, they're dealing with prisoners, they're dealing with gay people, it shouldn't really matter as long as they know what their rights, what their ethics are.
So can you give me an example, because you actually stood up on that?
Well, in Uganda they had we have a law against homosexuality, and government was trying to come up with another law, an additional law that is in the law, but they were coming up with a law which would require health professionals to disclose people who are gay. We said this was unacceptable as a profession. So we spoke out, and I spoke out as president of the World Medical Association then, and the minister took it seriously, and the Minister of Health, as a doctor, and communicated back to the head of state, and there was a change. That was let go because that part that was removed from the law, that requirement to disclose people who are gay.
On other cultural issues, and I know
there's so many other cultural issues. Yeah.
One of the interesting things was coming up. It was about the colonial cultural issues involved in regulation. It's a Western medical thing. What issues is that does that make for African nations, but also in the context of traditional medicine? As I throw everything into
the thing is, I think the most important thing. I'll give you an example of where cultural issues where we need to. The whole issue of people being autonomous, the whole issue of patient autonomy, of knowing that you're an individual, and that in a setting where family is very, very important in decisions to do with health, with your care. There's tendency to want to consult the family. And not only concern the one person, because we see people as part of a family and not as individuals. So that's another area that we need, that you need to really explore and get health professionals to understand that patients are autonomous, whether they are women, wives or daughters. It shouldn't make a difference, because in our setting, women have that low social-economic status, social status. Their decisions are made by others, either they're the spouses or made by their parents, made by their siblings, male siblings. And being a woman is seen as not, and therefore some of the health professionals have a tendency of consulting their husbands about care before they talk to the husbands before they talk to the patients themselves about the diagnosis and the treatment options and etc.
And is that the
because they have their traditional
to do that? Is regulation the answer to that?
No, the regulation is the answer to that, and regulation meaning that it's not only about policing, but it's about making sure that we train. We educate them to understand that patients come as individuals and they have their own rights as an autonomous agent. You know what I mean? And I think that is difficult. It needs a lot of training. It's not only training in medical schools, but also as continuing professional development, making sure that you continually remind people about these basic principles of ethics.
And just a question about being here at the conference. What are your takeaways, and what do you want put on the agenda really for African nations?
Well, the traditional medicine thing came up, and I think this is an area that should be a topic next time. There's a lot that we need to be doing, because right now in many of the African countries, if you can talk about 54, probably more than 40 countries are actually running parallel systems. Here you are, you're running a virus, you're listening to the radio and somebody's talking about a herb that cures, no evidence for it, but people listen to it. And unfortunately we're not as aggressive or as proactive in trying to counteract that particular type of misinformation, which we should be doing. It takes resources.
You mean
so these are the sort of things
in Africa?
In Africa and Asia. The difference is not really that big. So, and complementary medicine is everywhere. It's not only in developing countries, it's in developed countries. So how do we deal with that? How do we as medical regulators, who do we need to work with to be able to do this? And should we talk about doctors only, or we talk about all health professionals? Well, how does the public come in? In many of our countries, the consumer groups are not organized. You don't see consumer groups. And maybe that's what we need to be looking at. And also...
And is that you talking about traditional healers in the way that you need to stop them from making unwarranted claims for health?
Well,
but also is it...
Two regulatory things need to happen here. Regulating the media, which is largely unregulated in Africa, and also regulating the practitioners themselves.
And should they be integrated? Can it be integrated?
It must be integrated, because it is. If anything, it is the healthcare that we know. Anything else is foreign. It's foreign. So whenever we talk about that being foreign and this being it. But it has to be evidence-based. It has to be. We have to make sure that we respect the rights and that there's patient safety. Patient safety is very, very important here, and so it's very important for us to regulate it, because we are all looking at patient safety. So it's very important that we do, because we do have quacks among them. Those who are not. So we must integrate it. First of all, it's much nearer to the people. People accept it. People know it. People respect it even more than they do the Western conventional medicine. So and they are better communicators than we are. And they understand. They know the social cultural issues. So people listen to them. So we could do well with working with them, referring to each other, that sort of thing. Yeah.
That takes me to one last question, which is there's a lot always about how the lower and middle income countries can learn from the Western systems of how to do things. What can they learn from you?
Family. I think the need for continued community involvement, participation in health. Family, working with families, the whole issue of mental health. I'm a psychiatrist, and that's a big one that we really don't look at. But also social determinants of health, and looking at water, sanitation, and thinking, stop us thinking that health is about the health sector. Health is more than the health sector, and health actually begins in the home. And in our African, unfortunately, in the African, many of our African countries, preventive medicine is something that's not, it's really out there. It's not, and health literacy levels are very low, even among the most educated people.
But is IT actually changing that a bit? I've sort of
and
heard that
it is. We need to do a bit more. We are moving so slowly on that, on developing, on integrating IT into health, both as education and information. But we are still moving very slowly. It's taken us years. And I think a lot is because the hardware is very, very expensive, and I think we need to be doing a bit more advocacy. Those of us who are, at different levels of where we can actually, where we have forums where we can actually advocate to make sure that the costs go down, and they're affordable, so everybody has, access to this. But the mobile phone has really spread like wildfire.
That's right.
Yeah, and maybe what we're not doing is using it.
That would be interesting. That would be the next step.
There are countries that are beginning to use it. information and reminding women to go to it's time for you to go for your antenatal care and things like that.
So I'm not sure we haven't talked about that here. So that's two things on the agenda for the next one.
Yes. How do you? What about resource constrained settings? How do we? So that could be a topic.
Fantastic to talk to you. I think I grabbed more time than you actually could give to the conference. Thank you so much, Margaret.